Hi, everybody. Thanks for joining me today and hanging in there this late in the afternoon. My session today is setting up for continued success using SDoH data. My name's Andrea Green. I'm the manager of healthcare strategy for our SDoH product suite at LexisNexis Risk Solutions. I'm a licensed RN. I have about 9 years of clinical informatics experience. Prior to LexisNexis, I was at a large hospital system as a chief nursing informatics officer, focusing on transforming patient care, improving the health of our patient population, and data-driven optimization to help reduce the cost of care. So I'm just going to go over a quick overview of our SDoH solution before we dive in. We have 442 clinically validated attributes that have been sourced from over 13,000 unique data sources, both public data sources like census data, bankruptcy records, and also proprietary sources like, accident reports, education records, and death records, and so many more sources. We also provide 4 pre-built scores that address certain socioeconomic categories. Both our scores and our attributes are provided at the individual level in both our identified and our anonymized offerings. So some of the typical challenges that organizations face when trying to take on an SDoH initiative are things like not knowing the problem that they want to solve, or not knowing who to target, or maybe trying to focus on too large of a target. Other things like limited data, or only having clinical data, are also some common struggles. And then, of course, having too much data or not knowing what to do with all of that data, or even just trying to figure out what your logical next step is going to be, and to head in the right direction. So some of the ways that we at LexisNexis can help with those struggles are using our SDoH data to help identify socioeconomic barriers to help you decide, what problem you want to focus on. Our data solutions can help identify or stratify your populations, so we can really help you take a seemingly large, overwhelming number of people and help with risk stratification. And using our SDoH data along with clinical data or survey data can help you with a multi-pronged holistic approach when identifying and addressing socioeconomic barriers within your population. So we also offer advisory services that can partner with you to help comb through that tangled web of data and really start to form a plan and some actionable next steps. So here's just a basic structure of how to build a comprehensive SDoH business case. First, you need to identify and remove the SDoH barrier. Then you meet the need, meet the social services need. Next, you're going to impact that health behavior. And then lastly, you want to evaluate the outcome. The slide really highlights the importance of that a strong SDoH initiative must have each of these elements to be successful. So just launching, a transportation program without a clear focus on what the goal is will make it really difficult for you to evaluate your outcomes. A goal example can be something like making sure your diabetic patients get their yearly checkup to ensure they have, good A1C control, or they get their retinal exam and their blood pressure checked. So with good, clean, reliable data, you can take an in-depth look at your whole population. So for example, let's take a look at these 4 gentlemen here on the slide. Each of these men are 55 years old. They are all diabetic and they have COPD. So clinically speaking, they may look pretty similar at a glance, but then let's take a deeper look. So back to that first slide, step 1 is identifying and removing that SDoH barrier. We can see here that upon pulling their individual socioeconomic data, they're really starting to look very different. So they might look the same clinically based on, gender, age, and diseases. And you also have EHR histories and maybe some claims data that can help as well. But when we pull the LexisNexis SDoH data, we can see that Jack has no higher education. He lives in a high crime area, lacks transportation, and might live very far away from his nearest relative. So if you wanted to help him to manage his diabetes or his COPD, you might want to look into offering some services that can remove some of those barriers. Maybe he needs more one-to-one education for his diabetes, or maybe he needs help with transportation, or maybe he needs social support because he's struggling with social isolation. And then when we look at David on the right side of the screen, he's at a lower risk and may not need as much intervention when it comes to managing his diseases and engaging in his own health. So David might just need to be asked if he has any questions with his current treatment plan, or maybe if he needs some help with meal plan ideas. So having those SDoH insights can help you identify ways to approach each individual patient based on their needs. So this isn't necessarily a concrete if-then scenario, right? This is just having more information for your individual patients in order to know what questions to ask or what services to offer, or even just how to start a conversation. So steps 2 and 3 are meeting the social services need and impacting the health behavior. Here we can see some examples of local and global methods to applying the data. The left side of the slide shows traditional SDoH barrier identification. So that can be done at individual encounters, or by screening whole patient populations, or by just focusing on a high-risk grouping of patients. So in all of these examples, conventional sources of data are used, like patient questionnaires, surveys, or EHR data. But the need for SDoH data really boils down to the fact that self-reported information from patients is not always reliable, right? You can ask your patient screening questions, but the accuracy and reliability of those answers are often dictated by time, trust, and relationship. So sometimes patients are reluctant to disclose information on housing insecurity or food access because, maybe they're embarrassed, or maybe they don't want to be judged or generalized, or maybe they haven't established a trusting relationship yet with the person that's collecting that information, and they might be worried about being questioned on their ability to care for their children or even just care for their spouse. So when I used to work in ambulatory care, we would have patients fill out a stack of papers on a clipboard in a waiting room. And I'm sure you can all relate to this, right? Whether your doctor's office is on paper or they're using iPads, the fact is that you're going to fill that sucker out as fast as you can, because maybe it'll get you in the door quicker. Or maybe you don't want to be caught with empty paperwork in your hand when you get called into your room. But what I've also seen is patients often struggle with articulating even their smallest concerns on paper. Whether it's literacy level or even fine motor skills, there are just so many different reasons that surveys can be incomplete. So patient surveys should really just be a part or a portion of a multi-pronged, comprehensive approach to identifying relative states of health inequity or disparities. SDoH data provides those insights that might not always be apparent or forward-facing to help identify who's at the end of that inequity spectrum, who's the most at risk. You can't really do anything if you can't find them or identify them. So now we can take a look at the right part of the slide. These are population level insights to drive your organization's strategy to improve the overall health of your population. So looking at clusters of SDoH barriers in the community and maybe comparing them to clusters of diseases, identifying vulnerable communities like the elderly population or pregnant moms of color, and then strategically planning community level services or programming that could benefit these vulnerable populations. So throughout the market, we've seen organizations struggle with measuring impact or outcomes of SDoH initiatives. If you're not mapping out an evaluation program prior to the start of your SDoH initiative, you are going to struggle with seeing ROI. So if you think about it, you can't draw a treasure map if you don't know where the treasure is buried. I mean, sometimes it's nice to take the scenic route, right? But chances are, if you are constrained by budget or by time, or, a straight line is probably going to be the best idea. So in the next few slides, we're going to walk through these 4 different ways that you can measure impact and outcomes of your SDoH initiatives. So patient level evaluation can be measuring things like quality of life days using the CDC's Healthy Days measures. or looking at clinical indicators like A1C, blood pressure, weight loss. Other patient level metrics can include patient satisfaction or patient engagement scores, or the number of care gaps that have been addressed. You can also look at the reduction in risk scores or acuity level. And then looking at stages of change theory related to specific behavior. So when I first learned about this, it just blew my mind. It's so cool. So according to the stages of change theory, right, there are 5 stages of change. There's pre-contemplation, contemplation, preparation, action, and maintenance. So let's think about your New Year's resolution in this next example. I mean, it's September, it's a little early for that, but it's going to, New Year's is going to be coming. So you might want to start thinking about the holidays are over, are you going to start making a change in your life? And you decide to get a gym membership and you start shopping for a new pair of sneakers. So you haven't stepped foot in the gym yet and you haven't started lifting weights, but your contemplation and your preparation is already getting you closer to your health goals. So it's really important to understand that not everyone is moving from the preparation to the action stage. So even just jumping from pre-contemplation to contemplation to preparation can be considered a really big win, especially when managing health. So next is the operational level. So you can use solid metrics like the number of unique outreaches, successful connections, or the number of unique resource referrals or individuals screened and served. And then program outcomes. So you can use program outcomes to measure success, like things like the number of 30-day readmits or a reduction in the total cost of care. So also examining things like, ER utilization and the number of ambulatory care sensitive conditions that have been identified or diagnosed, because we know that studies have shown that identification and diagnosis of these ACSCs can help prevent the onset of an illness or condition that could potentially lead to like an unexpected flare-up or a decline in health that can lead to an inpatient admission, right? And then, of course, examining the care gaps that you close in regards to HEDIS measures. So looking at the number of breast cancer screenings or colorectal cancer screenings or cervical cancer screenings, prenatal and postpartum care, immunizations, and even just medication management for asthmatics or diabetics. And then lastly, looking at organizational impacts. So Population Health Management Journal conducted a study on patients enrolled in an SDoH assistance plan, and they found a $2,600 decrease in health costs for patients whose social needs were met compared to patients whose social needs were not met within that first 12-month post-referral period. And they saw another 10% reduction in the second year. So other organizational metrics can also include things like your CAP scores and your star ratings, and also your net promoter scores, patient satisfaction. How likely are you to recommend, right? How likely is that patient to recommend you and your company? So what's important to remember about all of these outcomes is that changing behavior and changing health takes time. So social determinants of health is becoming better understood and more sought after in the healthcare industry. LexisNexis is well positioned to help you think globally. Our data can help segment your population and identify SDoH barriers in order to strategically plan your next steps. And our advisory services can partner with you to examine your data to plan locally by taking a holistic end-to-end approach when putting together an SDoH business case, and then act with insight by getting our data into the right hands with interventions and outcomes in mind. So here are some acknowledgements and our reference links, and we've got some time for some questions. Does anybody have any questions for me today? All right, Roz, I think it might be coffee break time. You can always contact us. Our contact information is on the screen. If you have any questions, I'd be happy to follow up with you.
Thanks, Andrea. Sorry, I'm a little late. I was working on something else at the conference, but Now it's time to visit the exhibit hall by clicking on the Expo tab to win an Amazon gift card. Watch the leaderboard in the lobby to see who wins. We start promptly tomorrow at 10 East Coast time. Thank you all for being here today, and we wish you a nice evening.